To put the best performances in that they can, then that's what a successful game is.
That's all the sport for now. Chloe, I'll bring you the headlines in 20 minutes. See you then.
Thanks, we'll speak to you then. Now, leading members of the medical profession have raised concerns about the fresh series of strikes planned by junior doctors in England. The Academy of Medical Royal Colleges has warned about the impact of sustained industrial action on patients. The junior doctors insist the new contract, which is at the heart of this dispute with the government, puts patients at risk by imposing change with insufficient resources. Here are the details of the planned industrial action, which has been announced by the BMA. Junior doctors in England will walk out for 5 days from 8 a.m. on the 12th of September. Unless industrial action is suspended or called off, another strike is planned from Wednesday the 5th of October to Tuesday the 11th. In November, junior doctors plan to walk out for another 5 days from Monday the 14th. And in the run-up to Christmas, they're proposing to strike from Monday the 5th of December until Friday the 9th. Well, with me now is our health editor, Hugh Pym, also Liz McAnulty, who is trustee of the Patients Association, and from Worcester, Stephen Dorrell, the former Conservative MP and Health Secretary, who's now chair of the NHS Confederation, which speaks on behalf of organisations that plan, commission and provide NHS services. Well, Hugh, first of all, just take us through this. I mean, obviously it's early days, but presumably this is going to have a huge impact on routine operations, doctors' appointments within hospitals.
Well, that's right, Chloe. We've seen this before. We've had 2 all-out strikes by junior doctors. That was back in April, and there were thousands of postponed operations and outpatient appointments. It's estimated that in the coming weeks, action beginning on September the 12th, longer than last time, there'll be something like 30,000 routine operations and pieces of surgery postponed, and thousands more outpatient appointments. And if you multiply by the extra strikes we've heard about in October, November, December, you get up to something like 100,000 postponed routine operations. So it does have a big impact on patients. That being said, emergency care will be covered by consultants, and I think it's very important to point that out, that anyone who needs to go into accident and emergency will be looked after. And most hospitals coped pretty well with that side of things when this happened back in April.
But Liz, this is a real worry. I mean, I read just a couple of comments out before from people saying, well, I've got a routine operation, my husband's taken time off work, maybe you've got kids, whatever it is, you've got those plans in place. It's hugely disruptive and could potentially mean people don't support the junior doctors anymore?
Well, that's not surprising that people are very concerned about it, and very concerned for themselves, number one. But yes, there is a risk that the doctors will lose support. I mean, they have had huge support, as have all of the health service professionals and staff who are working in increasingly difficult circumstances. But for the patients now, there are 5 days, 30,000 as Hugh said, in the first 5 days. That's not just the 30,000 individuals affected, but all of their families, in many cases people with small businesses where they have to inform clients. It causes absolute havoc for the patients. And people worried, as one of the Patients Association reports showed a few weeks ago, already many thousands of patients are waiting much longer than the maximum time for knee, hip, cataract operations, things that really debilitate patients. They're now going to have to wait even as a result of this. So yes, it's devastating.
Let's bring Stephen Dorrell in as a former Health Secretary. What's your take on this? I mean, the fact that junior doctors are taking this much action, it shows how worried they are about this new contract.
Well, I think there are 2 points I want to make. The first is that it was the Academy of Royal Colleges, the professional leadership of the medical profession, that said today that this action is disproportionate. I completely agree with that, because you described the new junior doctor contract in your introduction as the government's contract. Actually, of course, this is a contract that's been negotiated over a very long period, measured in years. And in the concluding stages of that process, it wasn't the government, it was actually the independent ACAS mediation service, chaired by Sir Brendan Barber, former General Secretary of the TUC, so not an instinctive supporter of this government. And out of that process came a contract which 3 months ago, the leadership of the BMA themselves said was a good deal for junior doctors. Now, it's against that background that I think the move from industrial action in the first half of this year to considerably worse industrial action in the second half of this year is rightly described as disproportionate.
Hugh, come in on this, because as Stephen Dorrell rightly points out, the BMA did negotiate this, did recommend that junior doctors sign up to it. So it is a bit confusing for people now saying, well, why are they striking then?
Well, it is confusing, and as Stephen Dorrell said, the Academy got everyone round the table, a deal was done, and the BMA leadership signed up to it with the government. Junior doctor leaders then went round the country and said it was a good deal, but the membership voted against it. And what the BMA are saying now is, OK, we did what we thought was a good deal, but if 58% vote against, that's what the members want, we have to reflect. So they would say the majority of members want to go back to the negotiating table, although the government, understandably, are saying then sell it to the members.
Stephen Dorrell, you were trying
to come in? But surely the key issue, the key issue here is that a responsible trade union, which is what the BMA normally is, would then talk to its members, not as Mark Porter said on the radio yesterday, throw out the whole of this process and start again, move away from incrementalisation, as he put it, but would seek to demonstrate that the deal that they did in the context of the Independent Conciliation Service, the deal they did is a deal that may be with a couple of tweaks, but that deal should be, they should continue to recommend the deal they did to their members.
Liz, you wanted to come in?
Yes, I mean, the emphasis is on the contract, the junior doctor's contract, but the Secretary of State, when introducing the contract, it is to enable doctors to provide a 7-day service. Well, the difficulty we see from the Patients Association is we're already hearing from thousands of people a year about how the service is creaking at the seams already on a 5-day service. So we cannot understand how the health service can be expanded to provide a 7-day service without extra resources, and the government has said there will be no extra resources for this. So the contract and the blame game going on between Department of Health officials, the Secretary of State and doctors is going on and on. It's very protracted, but underneath all of that squabbling and blaming are many thousands of patients every day suffering as a result of the poor creaking services in many parts of the NHS, GP access, mental health services, I could go on. And what we really would wish for is that the Department of Health, the Secretary of State, the doctors would sit down today they can stop the devastation that's going to occur and solve the immediate problem. But that will only be the tip of the iceberg. They need to then look at the wider issues that are really causing serious problem for patients in health and social care.
Yeah, I think this issue of the 7-day NHS in England, it is a policy for England. It wasn't the Conservative manifesto, so the government feels it has the mandate to deliver it, but it's got all very confused in this argument over the contract, which in some ways is a very technocratic issue, a lot of detail about how doctors are remunerated at different times. The government has said we need the contract to deliver this 7-day NHS, but hasn't really explained how the two are linked. And junior doctors have been saying, well, we work anyway at weekends. This contract's nothing to do with 7 days. So I think the message hasn't really been handled particularly well and has allowed the junior doctors to say, well, we're just not convinced by this policy. So therefore, you know, we have major doubts about the contract.
Stephen Dorrell, what's the situation now for Jeremy Hunt? Because he, as the Health Secretary, negotiated this contract, was pleased. Presumably now his position is looking more questionable.
Well, I don't honestly think that Jeremy Hunt's position is relevant in this. This is a deal done in the context of an independent conciliation service. I agree.
It is relevant. His position is relevant because many junior doctors say that it's Jeremy Hunt himself who is causing the problems here. And actually, if he was removed, maybe they could make some progress. But
we can't have a position where one part of the workforce of the NHS is going on strike because they don't think that the Prime Minister has made the right appointment as Secretary of State. an argument about the terms on which the junior doctors are working under contract. Now, I agree with Hugh, actually, that it's a major distraction to be talking in this context about 7-day working. This is, as the exchanges between the junior doctor leadership on the leaked WhatsApp exchanges make crystal clear. This is an argument about money for junior doctors. It's nothing to do with the wider issues of the shape of services within the NHS. And in that dispute, this is what I think is unforgivable. Against the background of a long process that ended at conciliation recommended by the BMA, we're now seeing patients, the quality of service delivered to patients put unnecessarily at risk at the choice of the BMA.
Stephen Dorrell, thank you. I know, Liz, you want to make a quick point.
Well, just to say, we are encouraging patients, if they want to contact us for advice, to call our helpline. The number is 0208 423 8999. And for us to advise them on how, obviously we can't do anything about providing an alternative to their surgery, but to advise them the best way to negotiate an alternative date should it be cancelled. But we are acting on behalf of the patients to try and encourage all the relevant parties to try and sort it out as soon as possible.
Thank you for coming in, all of you. We've had an email from Pauline. I fully support junior doctors. I have a number of health problems and often end up in hospital. Junior doctors are doing amazing work and deserve to be rewarded. The government should learn to appreciate them before they all start looking for work abroad. Who will look after our patients then? And a text from Jim. Junior doctors have gone too far now. They have lost my support.